You would be shocked at how many times we do prolotherapy for stress fractures. I personally think part of the pathophysiology of a stress fracture is that where the stress fracture is, there's structures that are pulling on the bone there. So prolotherapy strengthens that part of the stress fracture. So we still might modify activities, and of course I'm going to look at why did the person get a stress fracture, and I'll be honest with you, most of the time it's nutritional. It's not overtraining. Like, I don't see that. It's normally that the person was training fine, but the structures there weren't strong enough. The bone wasn't strong enough, the periosteum wasn't strong enough, and then the structures that were attaching to the bone weren't strong enough. So when we strengthen the periosteum by prolotherapy, that means the covering of the bone. When we strengthen that, when we strengthen the structures, the tendons or ligaments that are attaching at those areas, and then we get at the root cause of what caused the stress fracture, which often is the blood is too acidic. So at Caring Medical, we check the pH of the blood. Sometimes there's a hormonal component. You know, if somebody, their hormone levels are low, we might give them those hormones, natural hormones. So in that sense, we get people back to their activities much, much quicker than if they just rest. You know, then they got to rehab it, you know, where if we just go right away, we do some prolotherapy, we get at the root cause of the stress fracture, then we get the people back in a fraction of the time. You know, they get back to their sports.